So the variable premium could be something like 25% charge on healthcare benefits.
Mhm.
It would be limited to, let's see, being no more than 3% of income. So it'd be somewhat like the Ontario premium right now, which is related to income.
Right.
Um, but it would also provide an exemption of the lower income groups, so low income people wouldn't have to pay it. And what would be interesting about it is you could run it through the income tax system, so people would not have to pay out of their pocket if they don't have the money for their healthcare services. It'll be settled up at a later time. Uh, the scheme that we had worked out a number of years ago would raise roughly $5 or $6 billion for healthcare. It would also create some incentives because people would then know that when they phone up many different doctors for services, they're going to end up having to pay a little bit more, which I think puts some impact, or at least makes people think a little bit more about how they use the healthcare system, because it was well known that some people had overused it. And so I think a lot of those things, I think, would make sense as an option for financing, running it basically through the income tax system. Of course, we could have just a healthcare premium like the one in Ontario, or the one that Alberta used to have, and make it sensitive to income levels. And that could be dedicated, put in a fund to fund healthcare. I would be fine with that. And even if we thought about having GST, part of the GST being dedicated, or the HST in some of the provinces being dedicated to healthcare, that would also make some sense if one wanted to do that, especially if you start building up funds, because we are going to go through a very fast aging in the population this decade. It's coming on a lot now. In Canada, currently 17% of the population is over the age of 65. That's going to rise to 22% by the end of this decade.
Right.
That's a huge change. And it means also there's going to be a lot more demand coming onto the system. In the meantime, we have waiting times that have now lengthened for many procedures after COVID. And so we need to put more money in the system, I think. And it would be nice, I think, it's not just going to be solved by, trying to cut expenses and efficiencies. We're going to still have to do that. But I think we're going to have to put some more money into the system. And I think thinking about some alternative ways of doing it, which are acceptable to Canadians, that would be very important.
Yeah, and have you noticed, though, that obviously there's this real fear, quite apart from additional money from the user of the system, but there is this fear of for-profit healthcare in this country. How is that? Can that be overcome, or is it just impossible to have that conversation?
Well, we already have for-profit healthcare, as I mentioned, in non-Medicare services, but even in Medicare, we do have private supply of medical services that are still paid for by the government.
Mm-hmm.
For example, creating clinics. In fact, there's ways of thinking about running the healthcare system, such as contracting out services, rather than just simply having a government body running the services. So to give you an example, suppose that doctors create primary networks, which everybody recommends as a way of trying to control the system, is you have a gatekeeper, which is what the UK does in their system. It allows you a much more integrated approach and patient-centered approach to healthcare. That could be done as a contract between the government and the primary doctor, and then behind the primary doctor, other doctors and specialists that the doctor would recommend to use. And that is an approach that I think would make eminent sense, but certainly is one way in which you can create more, let's say, competition and private supply within the system. Same thing applies to clinics where you get various procedures done, whether hip replacements or whatever. There's no reason not to do it. And of course, there are already private clinics you can go to in almost every province for certain purposes, which cover things that Medicare doesn't cover, but then at the same time, they'll recommend or provide the Medicare services that people are looking for. And that is another form of private supply. So we're already doing that to some extent. And I think Ontario's been very good, particularly at expanding private supply of publicly funded medical services. And as a result, they have many clinics where you can get different procedures as opposed to just going to one or two hospitals that ends up getting overloaded instead.